This conference will now be recorded.
Hello and welcome to Medicare 101. This presentation is for anyone who is soon to be eligible for Medicare. I have not been able to put on this presentation due to COVID-19 in my local community, so I decided why not record it, put it up on YouTube, and make it available to everyone. We will begin by discussing the program basics. What is Medicare? How do you enroll in Medicare? What are the Part A and B original Medicare benefits and costs? And what are Medigap, Medicare supplemental insurance policies? And how do those differ from Part C, Medicare Advantage plans and its benefits and costs? And then finally, Part D, Medicare prescription drug coverage. Medicare is a health insurance program for three groups of people: age 65 and older, under 65 with certain disabilities, at any age with end-stage renal disease, and it is administered by the Centers for Medicare and Medicaid Services, or CMS. President Lyndon Johnson signed the Medicare and Medicaid program into law on July 30, 1965. The four parts of Medicare. Medicare covers many types of services, and you have options for how you get your Medicare coverage. Part A, hospital insurance, helps pay for inpatient hospital stays, skilled nursing facility care, home health care, hospice care, and blood. Part B, medical insurance, helps pay medically necessary services like doctor visits and outpatient care. Part B also covers many preventative services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Together, Part A and B are also referred to as Original Medicare. Part C, Medicare Advantage, is another way to get your Medicare benefits. It combines Part A and B and sometimes Part D prescription drug coverage. Medicare Advantage plans are managed by private insurance companies that are approved by Medicare. These plans must cover medically necessary services. However, plans can change different co-payments, co-insurance, or deductibles for these services than Original Medicare. Part D, Medicare prescription drug coverage, helps pay for outpatient prescription drugs and may help lower your prescription drug costs and protect against higher costs in the future. So here are the Medicare Part A covered services. Includes the inpatient hospital stays, skilled nursing facility care, home health services, hospice, and blood. And most people receive their Part A premium free if you or a spouse has paid Federal Insurance Contributions Act or FICA taxes at least 10 years. If you've paid FICA for less than 10 years, you may have to pay a premium to get your Part A. And if you do not purchase your Medicare coverage when you're first eligible, there may be a penalty. Paying for inpatient hospital stays. There's a $1,408 deductible for each benefit period in 2020. And then from days 1 through 60, you're responsible for $0 co-insurance. From days 61 through 90, you would be responsible for $352 per day. And from day 91 through 150, you'd be responsible for $704 per day, with 60 lifetime reserve days. Original Medicare will pay for a total of 60 extra days called lifetime reserve days when you are in the hospital more than 90 days during a benefit period. Once these 60 reserve days are used, you don't get any more extra days during your lifetime. So if you're in the hospital for more than 150 days, you're responsible for all of the costs of an inpatient hospital stay. Automatic enrollment for Parts A and B. Those receiving their Social Security or Railroad Retirement Board benefits will automatically be enrolled in Part A and B, and your initial enrollment period begins 3 months before your 65th birthday or the 25th month of disability benefits. Anybody else who doesn't fit into those two categories but is eligible for Medicare must enroll themselves, and we'll talk about how to do that shortly. Once you're enrolled in Medicare, you will receive a Medicare card that looks much like this. It'll have your name and a Medicare claim number, whether you're male or female, and then your Part A and B effective dates. You can follow the instructions on the back of the card to return and refuse or opt out of Part B of Medicare if you like. We'll talk about the consequences and when that is a good decision and when that might be a poor decision. The initial enrollment period. You can sign up for Part A and or B during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. If you sign up for Part A and B, during the first 3 months of your initial enrollment, your coverage will start on the first date of your birthday month. Special enrollment period. After your initial enrollment period is over, you may have a chance to sign up for Medicare during a special enrollment period. If you didn't sign up for Part B when you were first eligible because you're covered under a group health plan based on current employment, either your own or your spouse's or a family member, you can sign up under Part A and or B anytime you're still covered by the group plan, or you have an 8-month period that begins the month after your employment ends or the coverage ends, whichever happens first. So it's important to note, for example, perhaps you continue working past age 65 and your employer is providing coverage. You might be 67 years old and you decide at that point in time to retire. If you did so, you would be able to use a special enrollment period and enroll in your Part A or B and not be penalized, even though you were 2 years past age 65. The general enrollment period. This is a period that runs each year from January 1 through March 31 for coverage to begin the following July 1. This occurs when you miss your initial or your special enrollment period. So if you did so, let's say for example, it was August and you were outside of your initial or special enrollment period, you would have to wait until the general enrollment period to enroll, and coverage would not go into effect until July 1. This means you could be without insurance for up to a full year. And once you did get enrolled at that point in time, there would be a 10% penalty for each 12-month eligible but not enrolled period. And that penalty would go forever with limited exceptions, which we'll talk about later. Enrolling in Part B if you have union or employer coverage. This may affect your Part B enrollment rights. So this would be a good reason why you could delay enrolling in Part B if you have employer or union coverage, or you or your spouse or a family member is disabled and still working and you have coverage. You would want to check to see how your insurance works with Medicare by contacting your employer or union benefits administrator. When employer or union coverage ends, when that happens, you will be offered a chance to elect COBRA, but for Medicare purposes, COBRA is not considered creditable insurance. And so instead, you would want to use your special enrollment period to sign up for Part B without a penalty. And then you would be able to go out and use what's called a Medigap open enrollment period, which is a 6-month period that starts from when your Part B effective date goes into place. Or you could also choose to enroll in a Medicare Advantage Part C plan, which we'll talk about later. COBRA not being creditable means if you elected COBRA and stayed on it and you missed your special enrollment period window, you would then have to wait for the general enrollment later on to apply for your Part B benefit and be subjected to a penalty. So it's important to note if you're leaving your employer to use your special enrollment window. When enrolling is not automatic. Some people need to sign up for Medicare. Those not automatically enrolled, for example, are not already getting their Social Security or railroad retirement benefits. So you might be 66 years old and waiting to take your Social Security to maximize that benefit, and therefore you would need to reach out to the Social Security Administration either on the phone, online, or in person at their offices to enroll yourself in Medicare. Skilled nursing facility care. You must meet certain conditions and require daily skilled services. And skilled nursing facility care does not cover long-term or custodial care. In order to be transferred to a skilled nursing facility, you must be an inpatient in the hospital for 3 consecutive days or longer and admitted to a skilled nursing facility within a specific time frame, generally 30 days after leaving the hospital. Skilled nursing facility care must be for hospital-treated condition or a condition that arose while receiving care in this skilled nursing facility for hospital-treated condition. And skilled nursing facility care must be provided by a Medicare participating skilled nursing care facility. Paying for skilled nursing facility care. In 2020, the first 20 days from day 1 through 20, you pay $0. But from day 21 through 100, you would be responsible for $176 per day. And then after the 100 days, you would be fully responsible for all of your costs. After the 100 days of skilled nursing facility care is up, you can qualify for skilled nursing facility care again every time you have a new benefit period and meet all the criteria. 5 conditions for home health care. To be eligible for home health care services, you must meet all of these conditions. You must be homebound, and an individual shall be considered confined to the home if the following 2 criteria are met. The patient must either, because of illness or injury, need the aid of supportive devices such as crutches, canes, wheelchairs, and walkers, the use of special transportation, or the assistance of another person in order to leave their place of residence. Or have a condition such that leaving his or her home is medically contraindicated. If the patient meets only one of the 2 previous conditions, then the patient must also meet the following 2 additional requirements. There must exist a normal inability to leave home, and leaving home must require a considerable and taxing effort. You must need skilled care on an intermittent basis or physical therapy or speech language pathology, or have a continuing need for occupational therapy. Your doctor must decide that you need skilled care in your home and must make a plan for your care at home. Prior to certifying your eligibility for the Medicare home health benefit, the doctor must document that the doctor or a non-physician practitioner has had a face-to-face encounter with you. The encounter must be done up to 90 days prior or within 30 days after the start of care. The law allows the face-to-face encounter to occur via telehealth in rural areas in an approved originating site. This means medical or other health services given to a patient using a communication systems like a computer, phone, or television by a practitioner in a location different than the patient's. And finally, the home health agency caring for you must be approved by Medicare. Paying for home health care. In original Medicare, for Part A covered home health care, you pay nothing for covered home health care services provided by a Medicare approved home health agency. If you have Part B, you pay 20% of the Medicare approved amount for an assigned durable medical equipment claim. If the claim is not assigned, you're responsible for whatever the durable medical equipment supplier charges over and above the Medicare approved amount, and we'll discuss assignment later. Hospice care. Part A also covers hospice care, which is a special way of caring for people who are terminally ill and their families. Hospice care is meant to help you make the most of the last months of life by giving you comfort and relief from pain. It involves a team that addresses your medical, physical, social, emotional, and spiritual needs. The goal of hospice is to care for you and your family, not to cure your illness. Covered hospice services. Here's a list here. Take some time to look at it and pause the screen if you need to, and I'll move forward. Paying for hospice care. In original Medicare, you pay nothing for hospice care. You might be responsible for up to $5 per drug to manage pain and symptoms. Room and board may be covered, and also short-term respite care. Blood, inpatient. If a hospital gets blood free from a blood bank, you won't have to pay for it or replace it. If a hospital has to buy blood for you, you will pay for the first 3 units per calendar year, or you or someone else donates to replace that blood. Now we're going to talk about what are the Medicare Part B covered services. Medicare Part B covers a variety of medically necessary outpatient services and supplies. Certain requirements must be met. Doctor's services. Medicare covers medically necessary doctor services, including outpatient and some doctor services you get when you're a hospital inpatient, and covered preventative services. Medicare also covers services provided by other healthcare providers like physician assistants, nurse practitioners, social workers, physical therapists, and psychologists. Except for certain preventative services for which you pay nothing, you pay 20% of the Medicare approved amount, and the Part B deductible applies. Outpatient medical and surgical services and supplies. Medicare covers approved procedures like x-rays, casts, or stitches, and you pay 20% of the Medicare approved amount for doctors or other healthcare providers' services. You generally pay a hospital co-payment for each service you get in a hospital outpatient setting, and the Part B deductible applies. Medicare Part B covered services continued. This includes durable medical equipment, items such as oxygen equipment and supplies, wheelchairs, walkers, hospital beds, etc. More Medicare Part B covered services, home health services, such as part-time or intermittent skilled nursing care, and physical therapy or speech language pathology services, and or services for people with a continuing need for occupational therapy. And other services include things like x-rays, MRIs, CT scans, EKGs, transplant services, clinical labs, diabetes supplies, kidney dialysis, etc. Part B, preventative services. This includes a welcome to Medicare preventative visit, and then after that, an annual wellness visit each year. And then here's a list of all the Part B covered preventative services. Take some time to look over these, and I will keep moving. Long-term care, routine dental care, dentures, cosmetic surgery, acupuncture, hearing aids and exams for fitting of hearing aids are not covered by Part A and B of Original Medicare. In 2020, you pay a monthly premium for your Part B, and that is $144.60 for the vast majority of Medicare folks. But if your incomes are in the higher brackets shown here, you will have a higher premium. In the lowest bracket, currently at $144.60 a month, going forward, your premium can only increase as much as cost of the living adjustments for Social Security. Paying the premium for Part B. If you are already taking your Social Security, Railroad, or Federal Retirement benefit payments, the $144.60 per month will be deducted from that payment. If not, because you are not taking your benefit payment, you will be billed every 3 months or quarterly for that Medicare Part B premium, and I highly recommend setting up Medicare Easy Pay to deduct that from a bank account so that you don't miss a payment and end up being disenrolled, which can cause all kinds of problems. There is a Part B late enrollment penalty. And so if you do not sign up for Medicare when you are first eligible and you do not have a special enrollment period, then there will be a 10% for each 12-month period penalty. And that penalty will last for as long as you're enrolled in Part B. Your Medicare coverage choices. So it all starts with Original Medicare, Part A and B. And then from there, you have the option to purchase either a Medigap policy plus a Medicare prescription drug Part D plan, or you can purchase a Medicare Advantage Part C plan, which sometimes includes prescription drug coverage. In some plans, you do have to pair with a standalone Medicare prescription drug plan. We'll talk about the differences between Medigap and Medicare Advantage as we go along. What is Original Medicare? It's a healthcare option run by the federal government that provides for your Part A and B coverage. You can see any doctor or hospital that accepts Medicare. You are responsible to pay your Part B premium. Part A is usually premium free. And then your hospital deductibles, your Part B deductible, and your Part B co-insurance and co-payments. Anytime you receive Medicare services, you will receive a Medicare summary notice. This notice will show what your doctor or provider charged Medicare for their services, and it'll show what was paid to them under the assignment or Medicare approved amounts. And that way you can track what's going on. Under Original Medicare, you can join a Part D plan to add drug coverage. Assignment. Assignment means that your doctor, provider, or supplier agrees or is required by law to accept the Medicare approved amount as full payment for covered services. Most doctors, providers, and suppliers accept assignment, but you should always check to make sure. Participating providers have signed an agreement to accept assignment for all Medicare covered services. Here's what happens if your doctor, provider, or supplier accepts assignment. Your out-of-pocket costs may be less. They agree to charge you only the Medicare deductible and coinsurance amount, and usually wait for Medicare to pay its share before asking you to pay your share. They have to submit your claim directly to Medicare and can't charge you for submitting the claim. And in some cases, doctors, providers, and suppliers must accept assignment, like when they have a participation agreement with Medicare and give you Medicare covered services. Non-participating providers haven't signed an agreement to accept assignment for all Medicare covered services, but they can still choose to accept assignment for individual services. Here's what happens if your doctor, provider, or supplier does not accept assignment. You might have to pay the entire charge at the time of service. Your doctor, provider, or supplier is supposed to submit a claim to Medicare for any Medicare covered services they provide to you. They can't charge you for submitting a claim, and if they don't submit the Medicare claim once you ask them to, call 1-800-MEDICARE. In some cases, you might have to submit your own claim to Medicare using Form CMS-1490S to get paid back. Medigap, also known as Medicare Supplemental Insurance. Medigap policies are private health insurance that cover only the policyholder, not the spouse, are sold by private insurance companies that help pay for gaps in original Medicare coverage like deductibles, coinsurance, and copayments. Pay for Medicare covered services provided by any doctor, hospital, provider that accepts Medicare. May cover certain things Medicare doesn't, depending on the Medigap plan, and must follow federal and state laws that protect people with Medicare. Your Medigap open enrollment period starts when you are both 65 and signed up for Part B. Once it has started, it can't be delayed or repeated. During your Medigap open enrollment period, an insurance company can't use medical underwriting, refuse to sell you any Medigap policy it offers, charge you more for a Medigap policy than they charge someone with no health problems, make you wait for coverage to start, except in certain circumstances. You can also buy a Medigap policy at any time a company will sell you one. If you buy a Medigap policy outside of your open enrollment period, you would be subject to medical underwriting. With a Medigap policy, you're responsible to pay a monthly premium to the insurance company, which is separate in addition to your Part B premiums. The cost can vary by plan, company, and location. Medigap insurance companies can only sell a standardized Medigap policy. These are identified in most states by letters, and only 3 states standardize their plans differently. Does not work with Medicare Advantage, and this just simply means that with a Medigap policy, you can't also purchase a Medicare Advantage plan. You could do one or the other. And with a Medigap policy, it's the same as original Medicare in that there are no networks, and you can go to see any doctor or provider that accepts Medicare, except with a Medicare Select policy, which is something that you don't see too much these days. Important note here, bottom of the slide, last paragraph. Starting January 1, 2020, Medigap plans sold to people who are new to Medicare won't be allowed to cover the Part B deductible. Because of this, plans C and F won't be available to people who are newly eligible for Medicare on or after January 1, 2020. If you already have either of these 2 plans, or the high deductible version of Plan F, or are covered by one of these plans before January 1, 2020, you'll be able to keep your plan. If you were eligible for Medicare before January 1, 2020, but not yet enrolled, you may be eligible to buy one of these plans. So if you're newly eligible to Medicare, starting the beginning of this year, you're locked out of any plan that covers the Part B deductible, which are plans C and F. How do you compare Medigap policies? If a percentage appears, the Medigap plan covers that percentage of the benefit, and you're responsible for the rest. So if you're looking at this chart on your screen, on the left-hand side, you see all the benefits, which starts with the Medicare Part A, co-insurance and hospital cost, your Part B, co-insurance and co-payments, blood, hospice, skilled nursing, Part A and B deductibles, Part B excess, and foreign travel. Plan F, for example, covers 100% of all of those except for foreign travel emergency. And Plan G is almost the same, except it does not cover the Part B deductible. Usually, the premium for a Plan G will be less than a premium for a Plan F, and we can get into the details on these types of plans at the time of making a decision. You can do this at Medicare.gov, by talking to an insurance company, or by reaching out to an insurance broker agent like myself. Medicare Advantage plans. What are they? How do they work? What are their costs? Who can join? When can you join and switch? And we'll be talking about all of that. Medicare Advantage plans are health plan options approved by Medicare and run by private companies. Medicare Advantage is also called Part C. Medicare Advantage plans are part of the Medicare program. They're just another way to get Medicare coverage. Medicare pays the plan a certain amount for each member's care. And if you join a Medicare Advantage plan, you may have to use a network of doctors and hospitals. The types of plans available may vary based on your service area, which is based on state and county. So basically, your zip code will determine which plans are available to you. How Medicare Advantage plans work. If you join a Medicare Advantage plan, you still have Medicare rights and protections. You still get all your medically necessary Part A and B Medicare covered services. You may get additional benefits offered through the plan, including Medicare prescription drug coverage, Part D, or other extra benefits could include coverage for vision, hearing, dental care, and/or health and wellness programs. Your benefits and cost sharing may be different than original Medicare. Types of Medicare Advantage plans. There are 6 main types of Medicare Advantage plans. Not all types of plans are available in all areas. Health Maintenance Organization, or HMO plans. In most HMOs, you can only go to doctors, other healthcare providers, or hospitals in the plan's network, except in an emergency. And you also may need to get a referral from your primary care doctor. HMO point of service plans. These are HMO plans that may allow you to get some services out of network for a higher copayment or coinsurance. Preferred Provider Organization, or PPO plans. In a PPO, you pay less if you use doctor, hospitals, and other healthcare providers that belong to the plan's network. You usually pay more if you use doctors, hospitals, and providers outside of the network. Private fee-for-service plans. PFFS plans are similar to original Medicare in that you can generally go to any doctor or other healthcare provider or hospital as long as they agree to treat you. The plan determines how much it will pay doctors, other healthcare providers and hospitals, and how much you must pay when you get care. Special needs plans. SNPs provide focused and specialized health care for specific groups of people, like those who have both Medicare and Medicaid, who live in a nursing home, or have certain chronic medical conditions. Medical Savings Account, or MSA plan. This is a plan that combines a high deductible health plan with a bank account. Medicare deposits money into the account, usually less than the deductible, and you can use the money to pay your health care services during the year. Medicare Advantage plan costs. If you join a Medicare Advantage plan, you must continue to pay the monthly Medicare Part B premium. A few plans may pay all or part of the Part B premium for you. Some people with limited income and resources may be eligible for state assistance. When you join a Medicare Advantage plan, there are other costs you may have to pay, including things like an additional monthly premium to the plan, deductibles, co-insurance, and co-payments. These may be different than original Medicare, may vary from plan to plan, and your costs may be higher if you go out of network. To be eligible to enroll in a Medicare Advantage plans, you must live in the plan's service area. You must have Medicare Part A and B, original Medicare. You must not have end-stage renal disease when you enroll. You must provide necessary information, and you must follow plan's rules, and you can only belong to one plan at a time. When you can join or switch Medicare Advantage plans, your initial enrollment period to enroll in a Medicare Advantage plan is the same as your initial enrollment period to enroll in original Medicare. And then after that, there's a Medicare annual enrollment period each year from October 15th through December 7th, where you can go out, look at competing plans, and make a choice for coverage to begin on January 1st. Plans must allow new members to join during that Medicare annual enrollment period. Special enrollment periods for Medicare Advantage plan. These includes moving out of your service area into a new service area. If your plan leaves the Medicare program or reduces its service area. If you're leaving or losing your employer or union coverage. If you enter, live at, or leave a long-term care facility. Or if you qualify for extra help or lose your extra help status. Extra help is a low-income subsidy. Or if you join or switch to a plan that has a 5-star rating. And there's some other exceptional circumstances. When can you join or switch a Medicare Advantage plan during a 5-star SEP? So, Medicare uses information from member satisfaction surveys, plans, and healthcare providers to give plans overall star ratings from 1 to 5 stars. A 5-star rating is considered excellent. At any time during the year, you can use the 5-star special enrollment period to enroll in any of these types of plans with a 5-star overall rating. Medicare Advantage only plan, Medicare Advantage plan with prescription drug coverage, or a Medicare prescription drug plan, or a cost plan as long as you meet the plan's enrollment requirements. For example, living within the service area. If you're currently enrolled in a plan with a 5-star overall rating, you may use this SEP to switch to a different plan with a 5-star overall rating. When can you leave a Medicare Advantage plan? So every year from January to February 14th, you can leave your Medicare Advantage plan and go back to just original Medicare. Coverage would begin the first of the month after you leave your MA plan. And if you make this change, you may also join a Part D plan to add drug coverage. And drug coverage will also begin the first of the month after the plan gets the enrollment form. and you cannot join another Medicare Advantage plan during this period. If you make the decision to do this, just know that you would have original Medicare and maybe a Part D plan, but nothing else to back up the out-of-pocket cost associated with original Medicare. So usually you would want to make arrangements beforehand to qualify for enrollment into a Medigap policy. Medicare prescription drug coverage. So what is Part D? What are the benefits and costs? Who can join and when can you join and switch? What are Part D drugs? What drugs are not covered and how do you access covered drugs? So the Medicare Part D is the other name for Medicare prescription drug coverage. These are prescription drug plans approved by Medicare but run by private insurance companies, available to everyone with Medicare, and you must be enrolled in the plan to get coverage, and there are two sources of coverage. You can have Medicare prescription drug plan, also known as a standalone PDP. These are typically paired with a Medigap policy, but also certain types of Medicare Advantage plans that do not offer drug coverage, like Medicare MSA plans and Medicare private fee-for-service plans. And then there are Medicare Advantage plans with RX coverage. These are also known as MAPDs. These are typically HMO or PPO plans or special needs plans under the Medicare Advantage system, and also some private fee-for-service plans include prescription drug coverage. There's a standard structure in 2020 for the Medicare Part D system, and every private insurance company that offers a Part D plan follows this basic structure. You may be responsible for a $435 yearly deductible. Most Part D plans these days will waive that deductible on Tier 1 and 2 preferred and generic drugs. After you meet your deductible, you will pay a copayment or coinsurance, which is what you pay at your pharmacy or through a mail order service. In this second phase of the structure, when you go to the pharmacy and you fill your prescription, you may pay a very small copay, let's say, for example, $1 for a generic drug, but there is a retail cost for that prescription. And let's say, for example, the retail cost of that drug was $100. That $100 would be tallied. And if the tally of all the prescriptions you fill at your pharmacy add up to $4,020, you would enter into the third phase, or the coverage gap, also known as the donut hole. And once you enter the donut hole, when you go to fill your prescriptions, you would be responsible for 25% of the plan's costs for brand name prescription drugs and generics. If all your out-of-pocket costs added up to $6,350 in this phase, you would enter what's called the catastrophic coverage level, and then your costs for filling prescriptions after that would go way down. This resets every year. The Part D income related monthly adjustment amount, or IRMA. If you're in the lowest income bracket, you would only pay your plan's premium for your Part D coverage. But if you're in any of these higher brackets shown on the screen in the right-hand column, you will see the premiums you would be responsible for in addition to your plan premium. These premiums are billed similar to how Part B is billed. through the Social Security Administration. Part D eligibility requirements. To be eligible to join a prescription drug plan, you must have Part A and or Part B. To be eligible to join a Medicare Advantage plan with drug coverage, you must have Part A and Part B. You must live in the plan's service area. You can't be incarcerated or live outside of the United States, and you must be enrolled in the plan to get drug coverage. When you can join or switch a Medicare prescription drug plan, the initial enrollment period for Part D is the same as for original Medicare, and Part C, it's the 7-month period that starts 3 months before your age 65th birthday. The Medicare open enrollment period for when you can switch your Part D plan to another Part D plan is the same as for Part C. You have a window every year from October 15th through December 7th for coverage to begin on January 1st. And you can also disenroll from January 1 through February 14th every year. Special enrollment periods for joining or switching a drug plan are the same as for Part C Medicare Advantage plans. The only additional thing to mention here is if you belong to a state pharmaceutical assistance program. These are typically programs for folks age 65 or greater, where they can apply based on a low income for this assistance program, and they would be able to make a change to any prescription plan they wanted to any time of the year. Late enrollment penalty for Part D. It is an additional 1% for each month eligible and not enrolled for as long as you have Medicare drug coverage. The 1% per month is calculated using the national base beneficiary premium, which was $39.63 in 2019, and changes a little bit each year. You will not have to pay a late enrollment penalty for Part D if you're using a special enrollment period to go into Part D because you had creditable drug coverage from an employer, or if you qualify for a low-income subsidy, also known as extra help. Part D covered drugs. These are prescription brand name and generic drugs which are approved by the Food and Drug Administration, used and sold in the United States, used for medically accepted indications, and includes drugs, biological products, and insulin and supplies associated with injection of insulin. Each Part D plan must cover a range of drugs in each category, but coverage rules can vary by plan. All plans are required to cover these 6 protected categories shown here, and all commercial available vaccines except those that are covered under Part B, for example, flu shot. Drugs excluded by Part D include drugs for anorexia, weight loss or weight gain, erectile dysfunction, drugs when used for the treatment of sexual or erectile dysfunction, fertility drugs, drugs for cosmetic or lifestyle purposes, drugs for symptomatic relief of coughs and colds, prescription vitamins and mineral products, and non-prescription drugs. Access to covered drugs. So each plan must cover a range of drugs in each category, but the coverage and rules can vary by plan. You can see these rules and coverages by looking at a plan's summary of benefits, and also their formulary, which shows the list of covered drugs and whether or not they require prior authorization, step therapy, or quantity limits. Under Part D, you have a right to file a complaint or an appeal for quality of service and care that is received. This is also known as a grievance. And you can appeal coverage or payment decisions by calling your plan the State Health Insurance Assistant Program for your state, or 1-800-MEDICARE. It's important to note that there are programs for people with limited income and resources, which include Extra Help, Medicaid, 4 different Medicare savings programs, which I'll show you later on. And there is help available to people in the U.S. territories and through your state health insurance assistance program. Extra Help is a program to help people pay for Medicare prescription drug costs, also known as a low-income subsidy. If you have lowest income and resources, you pay no premiums or deductible and a small or no copayment. If you have slightly higher income and resources, you will pay a reduced deductible and a little bit more out of pocket. You would not be responsible for the coverage gap or the late enrollment penalty if you qualify for Extra Help. You will automatically qualify for Extra Help if you get full Medicaid coverage, supplemental Social Security income, help from Medicaid paying for your Medicare premiums. All others must apply either online at socialsecurity.gov or by calling Social Security at 1-800-772-1213. And you can ask for the application for help with Medicare prescription drug plan costs by contacting them or your state Medicaid agency. What is Medicaid? This is a federal and state health insurance program for people with limited income and resources that covers most healthcare costs if you have both Medicare and Medicaid. Eligibility is determined by your state, and the application processes and benefits can vary from state to state, so you would need to contact your state office, and it's worth applying if you think you might qualify. There are 4 Medicare savings programs, which is help from Medicaid paying Medicare costs for people with limited income and resources. Often these are higher income and resource limits than for full Medicaid, and it includes the qualified Medicare beneficiary, the specified low-income Medicare beneficiary, qualifying individual, or qualified disabled and working individuals. And I will show you what the income and resource limits are on a slide towards the end of the presentation. The steps you need to take if you think you may qualify is to review your income and asset guidelines, collect your documentation, and get more information by calling your state medical assistance office or your local state health insurance assistance program or the local area agency on aging. They'll help you complete your application, and you'll be on your way. There are programs in the following U.S. territories: Puerto Rico, Virgin Islands, Guam, Northern Mariana Islands, and American Samoa. Here are the income and resource limits for Extra Help. Please take a look. You can make a little bit more in Alaska or Hawaii, but if you think you qualify, it's worth pursuing. And here are the income and resource limits for those Medicare savings programs that I showed you. The first one, QMB, is for Part A and B premium assistance. The second one, SLMB, is for Part B premiums only. Same for QI. And then finally, the qualified disabled and working individuals, maybe folks who weren't able to pay 10 years of FICA taxes, but can get an exemption on having to pay the Part A premium. Thanks for tuning in, and I hope this addressed any general questions you might have had about Medicare. And if there are any specific questions or other areas you would like more information on, let me know. Here's all my contact information. Also follow me on social media, Facebook, and YouTube for more info on insurance and financial topics. Thank you. Bye-bye.